New variants of coronavirus are stoking fears about a possible wave of infections this summer. For a look at how to protect ourselves from the disease and other big headlines in the world of health, let's welcome back Dr. Lipi Roy. Doctor, welcome back.
Good to see you, Hena.
Good to see you. So what's different this time around? What are the symptoms and the dangers of this new COVID strain?
So funny enough, it's called Flirt, an amusing name. It's also known as KP2, and this variant is now actually the new dominant variant, taking over from the previous variant JN1. The symptoms are actually similar to the other COVID-19 variants. So the most common symptoms that we're seeing are fever, chills, cough, sore throat, GI symptoms, as well as brain fog, headache, body aches. So not dissimilar from other COVID variants, but it is the new dominant variant that's now causing up to 1/3 of all new cases, Hena.
Will the current vaccinations work on Flirt?
Yeah, so the recommendation, if you recall from March, the CDC's recommendations are that you no longer need to isolate if you test positive at home for 5 days. However, the recommendations are if you feel sick, then you should stay at home, get the new vaccines and boosters. And then practice good hygiene, good indoor air quality. Unfortunately, only 22.6% of U.S. adults have the 2023-24 vaccines. So which means that there's waning immunity among the population, which will make us susceptible for a new wave. So the recommendation really is to get the updated vaccines.
Keep getting those vaccinations. So let's move on to olive oil. Apparently, it's not just a staple for cooking.
No.
It may also lower risks from somebody dying from dementia. We've learned this from Harvard scientists. A new study. What else?
Yeah, so this study which was done, published in JAMA, really it looked at over 92,000 adults over a 28-year period. And what it found was that people that consumed 7 grams of olive oil, which is really just half a tablespoon of olive oil every day, had a 28% lower risk of dementia-related mortality compared to those who didn't. Unfortunately, the average U.S. adult doesn't really consume olive oil that much.
That's surprising.
So I put olive oil in almost everything.
Me too.
So frankly, I think it makes things taste better. And so we don't know exactly why that is, but we suspect that there's antioxidant compounds in olive oil which can break through the blood-brain barrier, which can impact brain function. But it could just be the overall cardiovascular benefits associated with olive oil, which can have benefits with brain health.
I'm curious, any other foods that may be as beneficial as olive oil?
Yeah, so the brain healthy foods, I mean, again, mostly a lot of foods that have antioxidants, like blueberries, berries in general, but really anything that really helps your overall health, like heart health, can also help overall with neurologic function.
Okay, so there's another study I want to talk to you about. It's a busy day from the Journal of American Medical Association. Finds that when it comes to weight loss, a minimally invasive procedure is more effective than the weight loss drugs that so many people are on. So is gastric bypass, I'm assuming.
So this is a really fascinating study, again, also published in the medical journal JAMA. So the study found that this minimally invasive procedure called ESG, endoscopic sleeve gastroplasty, it doesn't really roll off the tongue. So ESG, it's minimally invasive, which means that you don't need a big, long incision in the abdomen. And instead what's happening is that a flexible tube called an endoscope is put down your throat, and that way they can suture the stomach and make it smaller, so reduce the volume of the stomach, as opposed to previously when it was done by cutting open the abdomen. And the study has shown that this procedure is actually it's cheaper, it costs less than medications over a 5-year period, like $19,000 versus $53,000 for the meds.
Wow.
So the most common med, as you probably remember, is semaglutide, which is found in Wegovy and Ozempic. And this procedure has been found to reduce weight loss more than the medications. We need more studies, but I mean, this is another option for people to utilize who need help with weight loss.
Especially so many people looking at the medications right now.
Yeah, exactly.
Summer. All right, Dr. Lipi Roy, we always appreciate your time, Doc. Thank you.
Anytime.
Thanks for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.